Baptist Health Marketing. How are you?
I'm good, thanks.
I also have John Fernandez here. John is the senior writer here for Baptist Health.
Hi, doctor.
Hello.
How are
Nice
you?
to hear you.
So, doctor, well, first of all, welcome aboard to Baptist
Thank
and
you.
to MCVI. How has your first few days been going?
Pretty nice, pretty relaxed. I don't have privileges yet, so waiting for all my credentials.
Oh, okay. So you haven't started seeing patients yet, correct?
Correct.
Okay.
All right.
Okay, so I was going through the National Health Observances, and very fittingly during American Heart Month is heart failure awareness. And since you are now the medical director of that program, we thought it would be nice to do a blog surrounding that. So I'm going to toss it over to John.
Hey.
So he can ask you a few questions,
Hey,
and we'll get underway.
doctor. Thank you. Can you speak? Are you okay for the next few minutes to answer questions? Or?
Of course.
Oh, great.
Yeah.
And obviously, heart failure is a very topical, I guess, topic. I've written over the last year. We've followed the trends, the national trends and studies that have come out, and I think there was one almost a year ago saying that heart failure has been on the rise, particularly among younger U.S. adults. I'm sorry, deaths from heart failure has been on the rise, due in part to obesity and diabetes epidemics. And I just wanted to, if you agree with that, or do you have any thoughts on that? And what trends are you seeing in terms of heart failure patients? And
So one important thing to emphasize is that because of some of the risk factors that you mentioned, like obesity, diabetes, are increasing, then we are going to see more patients with heart failure. Also because we have a big population of elderly patients, and those patients tend to develop heart failure as well. So in that regard, some of those trends are increasing. The other thing is that because of advances in care in the acute coronary syndrome, so patients who have heart attacks have better survival now. So they end up with some damage that will lead to heart failure. So, survivors of heart attacks can lead to heart failure. So we're going to see an increase on those patients as well.
okay.
The other trend that we're going to see is with the vaping. Vaping nicotine leads to ACS. ACS eventually will lead to heart attacks. So those are the trends. So heart failure is going to increase in the next few years.
Okay, and like I said, the growing elderly population, more survivors of heart attacks. Those are growing populations that may be susceptible to heart failure, or may
Correct.
develop heart failure. And also, I was reading that I guess the American Heart Association said these are estimates of the more than 6 million Americans living with heart failure. About 10% have advanced heart failure. About 10%.
Correct.
And is that the area where you deal with mostly in the program, advanced heart failure?
So the patients who had sustained damage to the heart muscle and are not responding to medical therapy or devices like defibrillators and pacers. Mm-hmm. So those patients is what we call end-stage heart failure or advanced heart failure. So by the American Heart Association and the ACC, which is the American College of Cardiology, we have different classifications, but an easy one to remember is the ABCD. So A is the patients who are at risk of heart failure. Let's say patients, like for example, hypertension, diabetes, smoking.
Right.
For example, that had a heart attack but didn't sustain damage to the heart muscle. C is the patient that has the structural changes to the heart muscle. and maybe or maybe not they have symptoms, and B is the patient with, chronic disease, multiple admissions that require more therapy. So that's the D part is the group that I'm concentrating on. So those are the patients that would, for example, eventually get mechanical pumps or heart transplants, or for some patients that are not candidates for those therapies, they will be on IV therapy to improve their symptoms.
Right, and in some cases, I know I've written about like the mitral clip, because I know Dr. Quesada has been at the forefront of stuff,
Correct.
and that was for extreme patients with advanced heart failure too, in terms of the heart valve, I believe, right?
So that's a subset of patients with well-defined inclusion criteria that would benefit from the clip. So,
right.
So those are patients who are on maximum medicines, oral medicines, and despite that, they still have symptoms and have the damage to the valve or like the mitral regurgitation.
Right.
Patients would be, if it's way too sick, then they will not meet criteria for the clip. So it's like a gray area.
Okay, it'll be only for a certain number of patients of that, because we've written about it so extensively, but the mitral clip is strictly for a subset of patients with advanced heart failure, right?
So usually patients, yes, it's a very limited subgroup of patients, and if they do qualify, definitely they will have better survival, better symptoms. So that's in the range of patients that we see with advanced heart failure.
Okay. Also from this, I think I got this from the CDC, some background information. About half of people who develop heart failure die within 5 years of diagnosis. Is that correct?
Correct.
Really?
Wow.
Wow. Yeah.
Yes. And that's something that we need to emphasize because a lot of even doctors in the community don't know those numbers, and we underestimate that. So, it's a prognosis that sometimes is worse than some of the cancers. And so the patient sometimes overestimates their survival. And so that's why we need to emphasize all the things that we can do to keep them stable, and emphasize education, risk factor modification, compliance with medicines, and
right. And
all those things.
And that leads me to my next question, which a lot of people may have misconceptions about heart failure because, the term itself is misleading. It doesn't mean your heart stops, but not enough, there's irregularities, not enough blood pumping or you think there is a lot of misconceptions out there about the condition of heart failure? People.
I think, for example, one of the important things to recognize is the presentation of the heart failure. It's not like the typical heart attack that you have the chest pain, and a lot of people recognize that if you have pressure in your chest, then that's a heart attack. Heart failure sometimes is more subtle, so we need to do a better job educating patients in, for example, identifying that it could be like just fatigue, just, shortness of breath, lack of energy, very specific symptoms. Sometimes in a lot of patients, it's just abdominal discomfort, bloating, and sometimes they get misdiagnosed. You just have pneumonia. You just have, cholelithiasis. So unless you have an index of suspicion as a physician, some of these patients will get delay in their diagnosis if it's not the typical patient that comes with the chest pain and then develop heart failure. And again, especially in female patients, these are very specific symptoms.
Right.
So that's why sometimes the mortality can be 50% at 5 years.
Wow. Yeah, that's a great point. And I know that if you have coronary artery disease, or high blood pressure, that in itself is a risk factor for heart failure, correct? And
yes.
And so
all those things we need to emphasize, highlight that there are a lot of things that you can prevent. For example, hypertension, diabetes, smoking. There are things that you can't control, like, for example, your age, your sex, or your family history, or your genetics. But for the things that we can control, it's really important so we can prevent progression to the end-stage heart failure.
And are there basic diagnostic tests that can detect possible heart failure condition, like echocardiogram? Or,
Yes.
I don't know.
So physical exam is an easy one, but there are some blood tests that could suggest to the physician that there's fluid overload, and an echocardiogram, so an ultrasound of the heart. It's probably the easiest way to detect the degree of heart failure and the subtype.
Right. And so you mentioned before the really key symptom is fatigue, or I guess shortness of breath. But I mean, obviously those are serious symptoms that if you have, you need to go see a doctor. You know, if it's chronic. But those are very specific issues, right? Correct fatigue or shortness of breath, or when doing certain routines, or
right. Yeah. And a lot of the elderly patients think that, it's because of age that I'm feeling like this. So, and they change their lifestyle. So, for example, instead of going outside and walking, they just walk less, and so they don't realize sometimes that they are having limitations in their activities of daily living. But in general, it's fluid accumulation. So if you have fluid accumulation in the legs, that's easy to detect. But if the fluid accumulation is, for example, in the abdomen, then you get misdiagnosed with a lot of abdominal diseases. If you get fluid in the lungs, sometimes you get diagnosed with pneumonia. So the echocardiogram is probably one of the easiest ways to define the heart failure.
Right, exactly. Okay, great. This is excellent information. Is there anything I haven't asked that you want to add to our discussion or to an article on this coming Heart Failure Awareness Week?
So, again, it's just emphasizing management of the risk factors, early referral, see your primary and your cardiologist if any questions arise. But for the end-stage heart failure patients, we really need to get patients as early as possible so we can offer them therapy. If they get to us too late, unfortunately, there's not much that we can do.
Doctor, it's Carmen. Really quick. So my understanding is heart failure cardiologist is the doctor that makes the decision as to a patient that requires a transplant.
Yeah, so for an evaluation for a transplant or a mechanical heart, the trigger would be from usually a referring physician that is suspecting that the patient is failing the medical therapy. It will get as a consult to us, and then we'll open an evaluation and see if that patient meets criteria. Once that evaluation is completed, then we'll have a committee where we discuss the case within a multidisciplinary group. And then, if the patient meets the criteria, we will go into a waiting list.
Okay.
If the patient doesn't meet criteria for a transplant, sometimes those patients can have the mechanical heart that will support the patient for the rest of their life.
Okay. So, essentially, your role is going to be in medication management and lifestyle changes to those already experiencing risk factors?
Yes, and early referral so we can offer advanced therapies for those patients that need it.
Okay. Okay. Your title is Director of the Advanced Heart Failure Program?
Correct.
Okay.
Yes.
Just wanted to make sure.
Advanced Heart Failure Program at Miami Cardiac and Vascular Institute.
Yes.
Great. Well, thank you so much. That was great information. And Doctor, I will, over the next few days, put an article together and send it to your way, make sure I got everything right. And
Doctor, any news on when you are expected to officially start seeing patients?
Don't know yet. I'm waiting to find out. They're going to approve some temporary privileges. I'm hoping that